So welcome everybody. My name is Debra Levin. I'm the president and CEO of the Center for Health Design. There are a lot of new faces to me in this audience, so for me that's very exciting. After 2 decades of doing this work, I feel like every time we have a gathering and a meeting, it's camp because you see so many of the same people. But I'm excited by this audience and the diversity of the crowd that we've been able to bring together for this conversation. So I have the pleasure of introducing and starting off the morning. The first thing I want to do is I really want to thank our partners. This was a huge undertaking to pull this together, and we are here today because of the generosity of Virtua. I'm working on 2 computers, excuse me. We're here today because of the generosity of Virtua, which was one of our Pebble projects. So for me, this is exciting to see this facility as it's up and running, and for us to really use it as a jumping off point for this conversation, because they've done a lot of work in this area. So I really want to thank you and thank Tejas and the whole group of people here at Virtua for hosting us and for making this available and for making all this technology available so that we can capture this and really have it for the future. Also, I'd like to thank our advisory group. If you're here in the audience, if you could stand up. This really was a huge undertaking. So Eileen, Don, John, Tejas, Jen, if you're here, if you could stand up and just let us thank you for all the work you've done. And I'd also like to thank the staff of the Center for Health Design. I know Ellen and Angela are in the room if you want to stand up and say hello. And then Matt, who is running around furiously making sure that all the pieces fall into place. So if you could just give him an attaboy. It's just amazing. So why are we even having this program, and why did we look to our friends at ARC for this funding? If you look back about a decade ago at the Institute of Medicine Errors report, we found that between 50 and 100,000 people were dying a year because of medical errors, and 2 million people a year were acquiring hospital-acquired infections. Almost 100,000 of them were dying each year. And there was a 20% turnover in our nursing staff. So now if you fast forward a decade, we find that still to this day that there are 25 harms per 100 admissions in a hospital, and 13.5% of Medicare patients experience some sort of an adverse effect, and that same number of Medicare patients experience some sort of temporary harm. So in a decade, we've really had basically no significant improvement in spite of all of the work that we're doing. And so what's so shocking about this is that when we looked at the figures, and we were so blindsided by that number of 100,000 unnecessary deaths, that what really happened was we drowned out the primary message, which is that it's really about the systems that aren't working, that our docs and our nurses are doing an amazing job keeping up with the technological changes and all that's happening in the industry, but the errors that happen, errors are just a part of what happens in everyday life, but they could have been prevented, they could have been mitigated by how we design our environments. And so that's really what we're here to talk about today, and that is, what can we build into our environments that really can help support the caregivers that are working to give the best possible care, so that the environment isn't actually a hindrance, but is actually helping to support.